Here's a quick take from the YoJoeShow Podcast.
Your companies own or control a health insurance division? Raise your hand. Please keep your hand up if you also employ healthcare providers or own clinics, specialty pharmacies, or any other kind of medical practice or pharmacy. Please keep your hand up if you also own or control a pharmacy benefit manager. And please keep your hand up if you lead a publicly traded company at which you have a legal responsibility to maximize shareholder value. So we've established on the record that the largest health insurance companies are not just insurers. They are also medical providers and pharmacies, diagnosing and deciding treatment for patients. They are also PBMs, another form of middlemen managing drug benefits. They are increasingly controlling every aspect of our healthcare system.
So there's no shortage of craziness going on.
Yeah, that's for sure. The health insurance also manage the physicians, also manage the PBMs, which are like the intermediaries between the pharmacies and the drug companies, which are super corrupt and enable huge waste. And then they also control the pharmacies and everywhere in between. It is just sickening, the situation. If there's one horrible thing about living in the United States, it's the cost and situation of healthcare. The quality of healthcare is remarkable, but the costs are unbearable compared to any other civilized nation on planet Earth. And it is because of this corruption that was enabled kind of decades of this uniparty government situation that enabled all of this corruption, where one company is behind everything that like we just saw in that video. Do you want to touch on either of those stories quickly?
Yeah, I would just say that I disagree about it being so great, the healthcare here in this country. The quality of care, unfortunately, has been co-opted and is controlled by the same corruption. Okay. Most cancer treatments, the person might survive their initial cancer diagnosis. Within 1 to 5 years, they have metastasis and progression of the disease because of how it's managed. And because of the metrics and how they look at things, they don't care. They consider it a success. It might be financially, but it's not for the patient and their families. I've seen this over and over again. Decisions are being made based on corporate greed. The health segment today is going to touch upon the new food pyramid and the changes that are necessary, which we've been talking about for a long time. And finally, there's been some changes made to this. We'll just touch upon that. We'll cover it more as the year progresses and we see where things actually wind up, but that was a needed thing. All of this speaks to the same basic problem, and that is essentially co-op and corruption of government programs and government money. SNAP. Who benefits historically from this? The beverage industries, the Coca-Colas, Pepsi-Colas of the world, because people who are receiving these funds to be able to eat and feed their kids, they're going and buying junk food, which then only makes them sick and obese. And then it helps the drug and medical industrial complex, if you can use the fancy terminology that people will levy on it. Again, all of these things in this episode have a basis of connection somewhere, but that's all I would say.
We hope you found our quick take segment informative. For more content, be sure to like, comment, subscribe, hit the notification bell, and watch the full episode.